Hey YouTube family, it's Denise here, aka West Coast Rust, coming at you with a plastic surgery consult update. It's been a while since I've done an update, a couple of weeks. I think this Friday will be week 46, maybe. So I'm nearing 11 months out from my RNY gastric bypass. I've lost a total of about 130, 131, somewhere around there, pounds. And I went yesterday, the 20th of January 2014, for a plastic surgery consultation in Corvallis, Oregon with Dr. Havard at Samaritan, oh shoot, I don't even know the name of it, Samaritan Plastic Surgery and Hand Specialist, something or other. Anyway, Dr. Havard, H-A-V-A-R-D is the name of the physician. So I went for a consultation regarding a breast reduction and lift, as well as a panniculectomy and abdominoplasty. So I was exceptionally nervous before I went in. I was vocal to people who know me closely about how I was worried, oh, he's going to say that I need to lose 10 or 15 more pounds, even though I'm in the surgeon's maintenance range, and I have been for a couple of months, you know. So I went there, and sure enough, he doesn't say I have to lose any more weight. He says I'm fine right where I'm at, or if I choose to lose more weight prior to plastic surgery, I can, and either way is fine with him. I also thought that there would be a slight chance he would say that I wasn't a candidate for plastic surgery yet, and he was like, no, you're definitely a candidate. So the way it works with my particular insurance that I know of is for the breast reduction and lift, because I am still a triple D, I'm a 36 triple D bra, even after losing that much weight, my insurance will basically cover 100% of the breast lift and reduction, which is fantastic. They will cover 50% of the panniculectomy, which is the lower roll removal. Now, as far as the upper part goes, the tummy tuck part from up above, they will not cover that. It is not technically covered for them. So, out-of-pocket expense before surgery would be about $2,600, and that's not too bad considering I can get a medical loan for it through my company, and it wouldn't be that bad. But the problem really lies in the fact that I would need a minimum of 2 weeks, but they say 3 weeks is what they tell their patients to tell their work if you have an office job like I do. I would need that amount of time off work, and unfortunately I have like 3 or 4 days. If you remember, close to a year ago when I had my bariatric surgery, they wanted me to take a couple of weeks off, and I managed to only take off 8 days because that's what I had. So I think it was 6 days. I had a week and a day. So I had surgery on Friday, and I was out all the following week, and then I was back the week after. So in my dreams, I could be back in a week from this surgery, the plastic surgery, but it's unlikely. He said that if I was lucky, I would be back in 2 weeks, but he tells everybody 3. So that kind of sucks, because really in reality, I don't care if anyone knows, but after taxes, I probably clear about $500 every 2 weeks. I don't work for much, and I only work half time, and so really I'm not really working for the money, I'm working for the benefits. And it kind of stinks to know that it's about $500 that's keeping me from having my surgery. Because I can't take leave without pay, and I'm not covered under the Family Medical Leave Act for federal or state because of the amount of time that I actually work. It's only half time, so it's not enough. So I realistically would not be able to afford the time off for about 7 months. And that's generous. That's a very tight estimate. That's if I took off no time between now and when I really needed to have this surgery. So, I doubt that I will have surgery in the summer, and it would be shocking if I was able to have it this next fall. If I have it in the next year, I would be completely surprised. But it won't be because I can't. It won't be because I physically can't or he doesn't want to do the surgery on me. It would simply be because I don't have the time saved up for my job. And this is the same position I was in when I had my bariatric surgery, so I'm used to being here. Let's see. For those who don't know a whole lot about plastic surgery or what have you, there are a couple of people who recently had surgery. One of them, of course, is VSG Tanya from New Orleans. Her videos are great. She's still very fresh out of her plastic surgery. And one thing that she didn't have that I will have is a reduction in lift on my breasts. And the ironic thing about that is that I've always suspected that one side is always bigger or smaller or lower or whatever than the other. And mine is pretty dramatic, actually. One hangs about 2 inches lower than the other. So I've always been a little off kilter, and that's the truth. This surgeon does not like to remove the nipple and graft it back on if he can help it. Depending on the amount of actual lift that needs to be done, he would actually cut a tissue that comes across the breast and then envelops the nipple, and then he would bring that flap basically out and then do the removal and then the reduction and then cut some away from other parts, and then he brings that back over where it needs to be. And the reason why he does that is because he wants to keep the main blood supply that comes into the nipple area, and also that's going to give you the best success for sensation after surgery. I am right on the cusp, I guess, of the amount of lift that's needed, because on one side they need to lift like 14 inches, literally, and one side is like 12 inches. And if you ever want to know how to test where your boob really should be, you put your hand under, you let them hang, and then you put your hand underneath of where they're at, and in that crease where it's at, that's actually where it should be. So mine is way the hell down there, and it should actually be about right here. And I don't know if that makes sense. They should be about like right here, and they're like way down there. So, yeah. My goal is to go a full C, possibly a small D, but really I think a full C is where I want to be. It's somewhere around 400 cc's if you were going to do an implant. So, yeah, the guy was really nice. He was very knowledgeable. I didn't have a whole lot of questions because I've done quite a bit of research on a reduction in the past because I always thought I wanted one. And now I know I really want one. And then I got to see some really cool pictures, though, of other weight loss surgery patients who had had the same procedures done. And then I got to see what it looks like if you're not a weight loss surgery patient and you just get a reduction and you keep that bulky frame. And definitely it's a good thing that I have made my body more narrow, because small boobs on a big body, it doesn't look very good. I mean, it looks like a boob, but at the same time it looks kind of different because you look so small and dwarfed with your rib cage area being so big. But he said that I'm a quite average size now, even though I know there are people who are smaller than me that aren't even getting surgery. And at 5'2", I know that some people want to be 130 pounds at goal or what have you, and I haven't necessarily claimed goal, but I've been at the same weight for the last 2 months, and if I get lower, I get lower. I'm enjoying eating pretty much whatever I want. In moderation. I mean, I don't eat bread and stuff like that, but I eat potato occasionally. I eat as much vegetables as I want. I get my protein in, and I'm not necessarily really watching my caloric intake either. And I haven't been working out, so the fact that I'm within a pound up or down on my lowest weight, I'm fine with that. I range anywhere from 155 to 157, and I've been sticking right there, and my maintenance range is 150 to 163. So I don't want to get anywhere near the 160 mark. I definitely want to be in the 150s or lower, but I'm not motivated to push myself right now. I guess that's kind of how it is. Now, knowing that I have quite a while before I can do my plastic surgery, he did say that if, when I want to schedule, they're about 8 weeks out, so he said call a couple months before I want to have the surgery and schedule it then. So, maybe this summer I'll be able to make that phone call and schedule it for the fall or whatever, and, we'll see what happens. That's kind of where it's at. So, Nice to know I'm a candidate. Nice to know that the guy has no problem doing surgery on me, and he would do it, like I said, he would do it in the next 6 to 8 weeks if I could afford the time off of work. But it is what it is, and now I know what I have to work towards, and now I know what's possible. I have no idea exactly how much the actual surgery would cost. Some people have come to me and said, oh, you know, if you wanted to, you could spend the same amount of money and go to, you know, one gal said Puerto Rico or something like that. Her daughter-in-law went there or something and got both of the same procedures done, and it cost her about $2,600, and she got to stay in a resort and blah, blah, blah. And, you know, no offense, but I'd like to go through my insurance company in case there are any complications, and I want to be home. I want to be close to home because the hospital it would be the same hospital I had my bariatric surgery, which is only 90 minutes from home. So I think that's beneficial. But anyway, I don't know if I'll do a Friday update since I'm doing this plastic surgery update now, and you know my weight hasn't changed, and nothing's really changed a whole lot. I mean, I've been working and taking care of my kid and just living life now, and that's what happens when you live life. You just, you know, I think it's a natural progression that you don't make as many videos and stuff, but I'm still all over the Facebook and everything, and I have been really lax on watching videos and commenting on videos and everything, and so yeah, I'm really sorry, but I've just been out doing other things, and online hasn't really been that much of a priority to me. So it's 11 minutes. I better get going or this isn't going to upload. So you guys take care and be well, and I look forward to seeing your guys' videos and getting back into the groove, and I hope you guys are all well. So thanks for watching.